Good evening, everybody. Again, I would apologize for this internet problem. It's mostly on my end here in Vegas. I've had a terrible time with internet connections for the last 2 weeks. Um, as Jim Harrell knows, and he's on this video, as Jim
Howdy,
knows,
Dennis.
hi, Jim. Have taught for Penn Foster for 10 years, and I've only missed one session, I think, in 10 years because of internet problems. And now the last 2 weeks, it's plagued me. And so I'm upset about it because I can't do anything about it. So Tim Barry has told me that if everything crashes here tonight, he and I will get together and we'll finish whatever we need to finish, and then we'll send the video out to everybody. So if it crashes, you'll still get the information. So what I was going to do here for the first part of this session was to talk about some challenges in veterinary practice or in veterinary medicine. And I don't have answers for these. I wished I did. I'm just going to bring up some of these issues and maybe make some comments as we move along. I'm going to start off pretty big here, talking about the world and the economy, and obviously we have all kinds of issues with oil prices, cutting off oil, banks. Our stocks have gone all to hell. Real estate has gone up and down. I mean, it's a whole cadre of issues. And that leads us then into, what is the leadership in the world doing about it? And everybody already knows about this. If you've been watching any news lately, the leadership just seems to get worse and worse. And terrorism is plaguing the entire planet now, not just certain parts of the planet. And we read about all this and try to keep up with it on social media. And a lot of people have concerns about how we use social media today. And all of this has kind of resulted in a changing of society. It's not the same as it was, certainly not the same as when I was growing up and when Jim Harrell was growing up. Things are not anywhere near that. And I wonder about my grandchildren, what are they going to experience in their lifetime? We've certainly seen a whole lot happen in my lifetime. And now we're dealing with four or five generations of people that are on the earth. And we have different ways of looking at things and doing things. And part of our problem with, we get back down here to veterinary medicine now, part of our problem with veterinary medicine is we don't have enough FTE veterinarians or FTE technicians. We have probably enough in numbers, but the difference is in the difference between the generations. And the younger generations, Generation Z, even the millennials to some extent, they have figured this out quicker than we did, I guess, and they do not want to work as many hours. And so they've kind of put the kibosh on when I got out of school working 60, 70 hours. That was the norm. Nobody thought anything about it. And now today, it's kind of shrunk to 50 hours, and now it's shrunk again to 40 hours. And now people want to work even less. So it does not, again, it's not just the numbers. We do need more people, but I think it's mostly the FTEs that we have. Our trends here, we're in a high-tech, high-touch society, and technicians really do an outstanding job of client communications. And there are a number of technicians that have bonded with clients to the point in practice where they come back to see the technician rather than to see the veterinarian. And there's nothing wrong with that. We don't care who they bond with, just as long as they bond and they keep coming back and using our practice. So not only high touch, but they also, our clients today, demand high tech. And I believe the profession has done a really good job of keeping up with technology, even to the point now where maybe we can't afford some of the technology that we can do. This last couple of weeks, I've been working with anatomy students, and we talk about kidney disease, we talk about heart disease, and yeah, we can do heart transplants, we can do kidney transplants, we can even do liver transplants. But most of our clients are not going to be able to afford anything like that. But we do have the high tech things in the practice today. But a lot of these need to be supported and run by our support staff, our credentialed technicians, especially in the laboratory and imaging areas. Second thing I have down here, we have an aging population. Baby boomers are the oldest in the population, along with some silent generations that are still left, but mostly baby boomers. They're retiring at 10,000 baby boomers a day, believe it or not. So there's a tremendous push for senior housing and senior care and all of this. And the seniors quite often have learned now that pets are a great comfort to them, and they want pets and they want them in their housing facilities. They want them in their care and recuperation facilities, and pets have been used more and more and more, and that has become, understood, I think, better and better by everyone in the country. Number three, there is a real sticking point for me, and that is the efficiency of veterinarians. I graduated from veterinary school in 1966. I've been a veterinarian, or I've been in the veterinary profession really for more than 60 years, because I started working with a veterinarian across the street from me when I was 11 years old. And so I have seen a lot of changes in this profession, but I have not seen many changes in the efficiency of veterinarians. It's still one veterinarian trying to service one client and one patient at a time. And we have not learned to use our credentialed technicians as we should have. And so therefore, it's no, surprise to me we have difficulty generating any revenue. We'll talk a little bit more about this here in a minute. But our efficiency, I don't believe, has changed a whole lot. A few practices now are starting to get the message and are using technician appointments and using technicians more than other practices are. The quality of our services, I think, have really increased. I mean, I just can't believe all the things. The veterinarian that I worked for when I first came into the profession did not have, when he graduated from veterinary school in 1944, he did not have radiology. He didn't have radiographs. They didn't have gas anesthesia. Well, I couldn't believe that. When I started to practice, he and I practiced together for 6 or 7 years in Phoenix, Arizona. I couldn't believe that, he had graduated at a time like that. Well, now fast forward, now here I am, and most people can't believe we haven't had ultrasounds and digital radiography and on and on, genetic testing and so forth. Well, things move. The quality of our services has really improved, and this has slowed us down some because we've not used our technical staff properly. Number five, there, leisure time. More and more millennials and Generation Z, they do not want to work. Some of them would like to work 30, 35 hours a week. That's it. And that never has computed with me because veterinarians have a fair amount of debt when they leave school, most of them. And I think it's very difficult for me to grasp wanting to work 35 hours a week with a $400,000 a year debt. I don't, I it just, my brain doesn't compute that. And, but That doesn't change the fact that millennials and Generation Z see things differently and work in the profession differently than many of us did. And we're going to have to change in order to accommodate those needs. The number of veterinarians, we're graduating a little more than 5,000 a year now. About 10 years ago, we were graduating about 4,200 a year. Now we're hitting 5,000, but we've added 4 new schools, and there's another school now that in Arkansas that has been put online to open in 2025. So we're going to have about 35 schools here in the U.S., another 5 in Canada. So we're going in North America, we're going to end up with 40 schools here pretty quickly. And we're going to need them because we just don't have enough veterinary hours out there to meet the needs. The number of veterinarians, this comes from AVMA, number of veterinarians in the last 50, 55 years has gone from 22,000. Last year, they just went over 100,000. Now, these are veterinarians who are members of the AVMA, and most practitioners are in this group. We have more veterinarians than 100,000, but many of them that are not in the AVMA are in other kind of sideline activities. They are not in practice. Most practitioners are members of the AVMA. So we've had a big jump in the number of veterinarians, but it's still not been enough because of the reduction in number of FTEs that we have. And again, 25% of new veterinarians, believe it or not, are educated outside the U.S. And that's not too hard to imagine when we think about veterinarians coming from the Caribbean. We have several schools down there. They are fully AVMA accredited. They can sit for the national boards just like anyone who graduates from the schools here on the mainland. The efficiency of veterinarians. This is where we start to get a rub. Looking at the efficiency of physicians and dentists, they see typically 40 plus cases a day per doctor. Ophthalmologists see even more. I was at my ophthalmologist yesterday getting an exam, and they just stack them in there like cords of wood, and they spend maybe the ophthalmologist might spend 5 minutes maybe with the patient. All the rest of the activities are done by support staff. They do all the testing, they do all the eye drops, the eye charts, all this stuff is done by staff. The ophthalmologist looks the records over and addresses the problem at hand. Where we compare to, MDs and dentists to veterinarians, the AVMA says the typical small animal practitioner now sees 15 to 18 cases a day. Banfield reported several years ago, and Banfield has probably a little better utilization of support staff than many practices do. And they were seeing in their newer practices 25 cases per day per doctor. And in mature Banfield practices, they were up to 35 per day per doctor. And so we have a long ways to go on average and trying to get our efficiency up. Here's an AVMA report that was published in 2017. This has not been redone since. This is the latest thing that I have, but the AVMA, again, looking at small animal practices, the typical small animal clinic is about 3,500 square feet and has just over 3 exam rooms. By just over, that's the average. And the average number of veterinarians in these practices is about a little over 3 per practice. And so this practice of 3,500 square feet, it has a little more than 3 veterinarians in it with 3 exam rooms, sees about 70 patients per veterinarian per week. And if you calculate that out, that comes out to 14 a day. That's not very many. Now, this does not include, I know they're doing some surgeries and they're doing some workups in addition, but we're not seeing the caseload through the examination room. So why don't we delegate more to our support staff? Well, what tasks really have to be done by the veterinarian? What tasks are required by state law, by licensure in all 50 states? Well, we have the four things listed here that the veterinarian must do: diagnosis, prognosis, surgery, and prescribing medications. The support staff, the credentialed, licensed technician, or I would like to get the name changed, as many of us would, to get rid of this technician title and go to nurses, because everybody knows what a nurse is, and virtually no one knows what a technician is. Except maybe the person that works on your car as a technician, or somebody that works on your computer as a technician. But there's not much connection between medical care and a technician. So we do need, and I've supported that 150% for 10 years. Hopefully we'll get that taken care of here pretty quickly. So those are the four things. Our credentialed nurses ought to be able to handle everything else if they're allowed to. And the problem is veterinarians basically are perfectionists. They don't trust anybody except themselves, and they're not very efficient about trying to get this stuff done. That's the issue that we're having. So how can we be more efficient? We must learn to multitask as a profession. We have to work in more than one exam room. Well, the very first problem that we have is we don't have enough exam rooms. Now, new clinics that are being built now and within the last 6 years, the architects are putting more exam rooms in, but we need at least 2 exam rooms for every veterinarian who is on outpatient. If we have a larger practice, and we're getting larger and larger practices, say we have 10 veterinarians in a practice, well, not all 10 of them are going to be on outpatient at any one time. There might be maybe 6. 1 or 2 people will be off that day. One person may be doing treatments, another person may be doing surgery. So we might have 6 seeing outpatients. So with a 10 veterinarian practice, we probably ought to have 12 to 14 exam rooms. We don't need 20 exam rooms. Okay, so we need to be reasonable about the number of exam rooms. We need to learn to delegate, and this is certainly not being taught in veterinary schools. I taught veterinary students for 35 years in 3 different teaching hospitals, and I know firsthand that we tried to get our students, our 4th-year students, to utilize staff, but the staff just aren't there as the student's assistant or support. The staff is there to teach. Most credentialed technicians in veterinary teaching hospitals are on duty to instruct, whether it is in the treatment room, helping with treatments in the ICU, in prepping animals for surgery, administering anesthesia, doing imaging. It's almost all done by the technicians instructing others how to do it. They're not there helping the student. So to me, it's really no big stretch of the imagination that once somebody graduates from veterinary school, they've not really ever seen a support staff person operating the way they should. And so when they get into a bind, they need some help. When they get into practice, who do they holler for? Another veterinarian, because that's who they've always used as their classmates and other people that are around them that are not support staff. They're not used to using it. So I'm happy to report that the AAVMC, which is the group that oversees all the veterinary schools, the AAVMC has been looking into trying to utilize support staff as part of the teaching hospital to actually provide support to the students so that they can learn how to properly use these people. So we need to teach veterinarians how to use credentialed staff. Another thing that will improve our efficiency is to pay people reasonably for making an effort to see as many cases as they can judiciously. We're not just trying to run a conveyor belt. We're trying to do high quality work, but we need to be more efficient about the way we work. This means we need to be in 2 or 3 exam rooms at a time when we're an outpatient, and we need to be letting the staff prep and do the post-op stuff while we're in surgery. And in some cases, we might even need somebody to scrub in to help us to reduce that length of surgery so that it's safer for the patient, less anesthesia all the way around. We need to figure out how we're going to use these people to help us with that. And so professional staff and support staff both, I think, would profit by having some kind of incentive. And there are practices out there now that do have some incentive going. The electronic veterinary medical record, that's EVMR there. The electronic medical record has improved our efficiency somewhat. I believe that we are on the way to having electronic records all the way around. Of course, there are practices like Banfield and other corporate practices now that have complete electronic records. That's wonderful and great, and I hope that that's what we can move toward quickly. Certainly, we have used the internet, and we certainly are using our cell phones, our smartphones, to communicate with clients. Some of these clients were doing this for telemedicine now. We've been pushed into this by COVID, and we have I think, moved much quicker into the internet era of practice because of COVID. We haven't had a choice. We've had to figure out other ways to communicate rather than face to face. We're doing now online appointments. A lot of practices are giving people incentives for making their own appointments online. And they can do that if we have a schedule posted with times that we don't want appointments X'd out. And many practices, or at least some practices here in Las Vegas, now have veterinary technician appointments. And those are using our veterinary nurses to do routine things like immunizations, like rechecks. As long as it is routine, the client may only see the nurse. This is no different than the physician's assistant. Physicians have been utilizing physician's assistants like crazy since the COVID pandemic. And many people, I've been told, many people prefer to see the PAs rather than seeing the physician sometimes. And so I think that we have lots of opportunity to do the same thing in veterinary medicine. We're using or starting to use telemedicine. AVMA now has a complete page or two on their website talking about use of telemedicine. And it's very much in the utilization for follow-up. Many surgeries could be routines, could be followed up through telemedicine to improve our efficiency. And we do need, however, I think to hang in there strong and require that in order for telemedicine to be used, you must have a veterinary client-patient relationship. That's what the VCPR is. And there are some states now that are trying to abandon that and allow a veterinary client-patient relationship just over the internet. And I don't believe that is in the best interest of the patient, of the client, or of the profession. I think we need to have face-to-face for some things, but certainly telemedicine can aid in improving our efficiency. So down here at the bottom of this slide, I'm talking about setting some goals. And we talked earlier about, seeing 14, 16 cases a day. I'm suggesting we set a goal to see 25 cases a day. And another goal that each veterinarian, each full-time equivalent should be able to generate $1 million. Now that sounds like a lot, but I'll give you the background of how I got to that number. And I have an example here in Las Vegas that's been doing this for more than a couple of years. If the veterinarian that was on call, FTE, we have full-time veterinarian, or they're on outpatient, and they see 5 hours of outpatients a day, and they're able to see 5 cases an hour. Okay, so that's a little bit less than 10 minutes, or excuse me, 15 minutes per case. And that should be able to be done if we're properly utilizing support staff. So that would give us 25 cases then. If we saw 5 an hour and we did 5 hours a day, that'd be 25 cases. If we added to that our veterinary nurse, and we had them see 2 cases, even an hour, and they were only on for 3 hours a day, they would see then 6 more cases, so that between the two of us, between our nurse and ourselves, we ought to be able to see 31 cases a day. If we saw 31 cases a day and we work 4 days a week, even, I'm becoming realistic about the number of hours and days that people say and will want to work. This could be even ramped up more if you wanted to work more hours. But I'm saying working 4 days a week, this would be then 124 cases in those 4 days then per week between the two of us. And if we work 46 hours or 46 weeks a year, again, that's giving you 6 weeks of vacation. Okay, that then would allow us to see 5,700 cases, and I am averaging out $200 average per case. Where did I come up with the $200? Well, the average office visit now is somewhere around 60 to 65, could be even a little higher in some of the large metropolitan areas, but I use the number 60 for an office call. And it's long been known that 3.5 times your office call should produce your average transaction fee, and which would be in this case $210. So I use 200. That's where I came up with the 200 number. And as you see, that calculates out to 1.2 million a year. And again, only working 4 days a week and only working 46 weeks a year. This can be done. We just need to get the profession on board to try to do that. So what are the challenges here that we're facing? Well, the biggest challenge that I see today are corporations. And I say that having been a private practice owner at one point in my career, and I don't have the answer to this. We don't even know how many corporations are buying up veterinary practices today. We know that Mars, a company, is the largest. By far, they're the largest employers of veterinarians, and apparently they now make more income through veterinary medicine and their auxiliary services of veterinary medicine, like universal ultrasound and like Antech, and like about 20 pet food companies that they own, believe it or not. When you add all those, they make more money now in veterinary medicine than they do selling candy. Unbelievable. But I see why practitioners are being picked off by these corporations, because they're paying 2 to 10 times what the practice is worth. And if you're getting ready to retire and you could sell it to, if you could find somebody qualified, you could sell it to another veterinarian, maybe in your practice, or somebody else that wants to buy the practice for X amount, or you could sell it to a corporation for 3 to 10 times X. And so I understand why they're doing it. Now what's happening is these numerous corporations, and again, I don't even know how many there are out there, there may be 15 or 20, they're now buying each other out. And we'll end up with 5 or 6 big corporations, I suspect, in another 5 to 10 years. Telemedicine we're using that. That is a challenge. We got to figure out how to use it effectively, but we also have to know how to use it safely and professionally. That's why we can't let the veterinary client-patient relationship slip out of using telemedicine. We have to have that included. Educational debt is coming down, as reported by AVMA. One of the big challenges is corporations are just taking over the planet. And I just checked recently to try to determine how many veterinary medical corporations there are. And the information that I could find, there are 60 or more corporations. The largest by far is Mars. And the Mars Candy Company employs more veterinarians, has more practices than any other entity currently going. And so I think we're going to see more and more corporate buyouts. And the reason is because they offer anywhere from 2 to 10 times what the practice is really worth. Now, I don't know how they're able to do this, but corporations are throwing a lot of money out there to buy up practices. Therefore, I think this is probably going to continue. In my estimation, I think having veterinary medicine run by a group of corporations is going to eventually be negative for the profession. Right now, we probably have, again, we have 60 corporations, but we probably have about 10 that are largest. And again, Mars is by far the largest. I think when this is all over, we'll probably end up with 5 or 6 corporations that will completely own the profession. And I just don't see this as very positive at this point for the profession. I don't know what to do about it, however. This is something we're just going to have to keep an eye on. Telemedicine is another challenge. There are states now that are trying to push for telemedicine to be used without the establishment of a veterinarian client patient relationship face to face. They're trying to get it so that you can get this association with the client via telemedicine, via the internet. And I don't think that's in our best interest. AVMA does not like that either. This is an area we're going to have to keep an eye on, that we need to have face-to-face contact with the client and the patient prior to establishing a relationship with a client and a patient that we can then handle via telemedicine. Telemedicine is good for lots of things, for follow-ups and so on, as long as you have that veterinarian client-patient relationship to start with. Another challenge, of course, with this has been a long-term challenge, has been educational debt. Not so much for the veterinary nurse, but more for the veterinarian. The numbers that we see from AVMA, and they're the ones that keep book on this. The latest that I saw was June of this year, 23, in which they're now saying the educational debt is about 180,000, and the average starting salary is about 100,000. So the debt to starting salary is 1.8, and anything above 1.0 is difficult to pay your debt back. And physicians are still 1 to 1. Their debt is something about that, like that, but their salaries start off of 180 or $200,000 too. So it does not take them long to pay off their debt, and their salary goes up. Veterinarian salaries pretty much pegged there around 100,000, $125,000 or so. And since there are more corporates in the ball game all the time, they don't get the equity development of the value of the practice. That's no longer there. So all they have is whatever the salary is when they finally decide to retire. The income, I think we can just both agree that DVM and veterinary technician income are, it's a struggle to be able to make a living for both of them. And they both need to go up. And I don't know how that is going to happen. Veterinary income has gone up quite a bit the last 2 or 3 years. And I know the last NAVTA evaluation of the veterinary nurse, the average national annual salary now is up to 52,000 average. And they go anywhere from 40,000 up to 65,000. So those salaries have gone up too. We need to use and properly utilize veterinary nurses. I think this is probably the answer to many of our problems, is to use the veterinary nurse as they're intended. Now, there's a movement out there just in the last few months in which there are some groups that are trying to establish a mid-level veterinary nurse practitioner. This is based on the nurse practitioner in human medicine, and they are licensed. They can prescribe, they can do certain things. I have a problem with this, as does AVMA. AVMA is definitely not for establishing another level of veterinary nurse. What we need to do is utilize the veterinary technician slash nurse position that we already have. We need to learn to utilize that. We still have not utilized it properly. And I think if we do, where the veterinarian and the veterinary nurse work together to make both more efficient, our practice will be more efficient and also more profitable. So I don't think establishing another level with another term in here, a veterinary nurse practitioner, I think it's just going to cloud the issue. It's not really going to help anything. And again, AVMA is pushing to not establish this. And so I hope that we're able to utilize what we already have before, maybe sometime in the future, this might become helpful, but right now I don't think it is. I think it's more of a negative than a positive. Finally, the last thing on this slide, the number of people that we have in the profession, both veterinarians and technicians. It's reported all the time, we don't have enough, we don't have enough. I think we have enough. The problem is differences in the different generations. The Generation Z, as well as millennials, do not want and are not working as many hours as the older generations worked. And because of that, our problem is not that we don't have enough. Our problem is that we don't have enough working the traditional hours they've worked in the past. I don't have a quick solution to this. I think we are going to have to put out more practitioners. We're going to have to put out more veterinary technicians to meet the need. But I think that we'll come a long way to being able to establish what we're supposed to be doing in a practice by better utilizing the people that we already have out there. And we have to, as a profession, learn to utilize the veterinary nurse slash technician. And I think even changing the name from technician to nurse will also be helpful. We currently graduate about just a little over 5,000 technicians, actually 5,200 technicians a year, and about 5,000 veterinarians. So we're still graduating more technicians than we are veterinarians. Moving to the next slide here, some of the conclusions in all this. We certainly need to increase our market. We have to improve our client education. We have to have better educated clients that will call us when there are issues, will present the animal at a proper time, and we need to spend a little bit more time in our practices educating the client about what we're seeing, why we're seeing it, about our recommendations, and why we are giving those recommendations. And many of these can be underscored by the veterinary nurse as they finish with the client, and to be able to move them along in client services. The veterinary technician slash nurse is the person that is, I think, key to all this, to spend the time necessary to make sure clients understand what we're doing and why we're doing it. We need to have appropriate patient evaluations, complete physical exams, and in most cases, we need laboratory work. We're beyond the point where we can just look at an animal and say, well, I think it's probably this, let's try this for a while. We're beyond that. We need to practice more scientifically. We have the ability, we have the equipment in the practice, we have the facilities to do this, and we need to work up the patient properly. The veterinary technician is very much involved in this. We should have at least 2 physical exams for every patient that comes in. One given by the veterinary technician as they take the history in the examination room, and then a second physical exam followed up by the veterinarian. And I can't tell you how many times I have missed things that technicians picked up later, uh, or vice versa. The technician may not pick up something that I pick up. And I think having 2 evaluations is the way to go, and to utilize our veterinary technician in the exam room more than we have. Another thing that will help us, since we're having difficulty paying ourselves and technicians in the profession, we need to charge for all services. It's too easy to take a radiograph or several radiographs and evaluate them and say, geez, we didn't find anything. It's going to be no charge. No, that's not the way that it should be done. What we should be doing in those cases is saying, guys, I thought this was going to be something more difficult, and we did not find what I was looking for. It's negative. That's good for the patient, but we still need to evaluate why we're seeing this or that. And we need to charge for these services because we are providing professional services. In pricing, we need to price our services so that we are fair to ourselves as well as being fair to the client. I'm certainly not proposing that we overcharge anyone. We're certainly paying grossly overcharged fees in human medicine and in dentistry now. The dental profession now, to have more patient insurance, they've gone bananas in the last 4 or 5 years as well. It is just unbelievable. We look at a ovarian hysterectomy that we charge maybe $200 or $300 for. If it was on a human, the same procedure, essentially the same kind of workup, it'd be $30,000, $40,000, and we do that procedure for $300 or $400. There's a tremendous difference in pricing. So we have to be fair to ourselves as well as fair to the client. Pharmacy is not a very good income for us anymore. We're going to see continued declining sales. More and more people want to buy drugs because they think they can get them cheaper online. And most veterinarians do not mark up drugs more than 100%, maybe 125%. There are many products, of course, at the pharmacy, that human pharmacy now I'm talking, that are marked up anywhere from 500 to 4,000% and even higher, especially the chemotherapeutic drugs. It's just unbelievable what they are charging people because most people have insurance, therefore they're going to pay the full fee. So strategy in building a practice, then we need to look for quality rather than quantity. And I know there are practices out there that would like to have more cases to look at, but most of the people that I've talked with and been in contact with over the last several years since COVID, we have so many patients now that most people are complaining they don't have enough time, they don't have enough people, we can't see everything. I think we need to be refocusing on the quality of our service rather than the quantity of our service. And this has to do with our management of our practice management. Again, as I said, we need to charge fair fees both for the client as well as the veterinarian. Another strategy is that we need to have full service. The client today is looking for one-stop shopping if that's possible. Not only are they looking for their veterinary services, which would include, vaccinations, all routine surgeries, all diagnostics, but they would also like to have grooming if that's possible. They would like to have boarding. And more practices today are trying to offer full service, one-stop shopping. That's what the client wants. Some places can offer this easier than others. If you're in a shopping mall, you may not be able to offer full service because you cannot keep animals overnight. Therefore, you can't offer boarding, or you can't offer extensive hospitalization. You have to refer the case. But wherever possible, one-stop shopping, that's what people are looking for, and that's what they want. There was a period of time where we were trying to get rid of boarding and grooming and so forth. But today we realize that for convenience, that's what the client wants. The strategy here about delegation, that is key to everything that we have talked about for this hour. Delegation, increasing the efficiency of our practice by delegating to our support staff. And the veterinarian needs to utilize the veterinary technician / nurse. This will increase the efficiency as well as increase the profitability. Now, I have a example here of the staff veterinarian ratio. We should have, according to AVMA, this was a study that they did in 2021 and published in the AVMA journal, that the minimum staff ratio should be 1 veterinarian with 6 support staff. Now, what is support staff? Support staff would be receptionists, technicians, veterinary assistants, and kennel staff. This would be all our staff, should be at least 6 support staff per veterinarian. Now, to drive this home, in case you're have been involved in, or you're in a practice now that, they only have 2 or 3 support staff per veterinarian. Well, it's no wonder that they're not efficient. But we have a practice here in Las Vegas for the last few years now, private practice, that the support staff ratio to the veterinarians, 1 to 20. They have 3.5 FTE veterinarians, full-time equivalent veterinarians, and 70 FTE staff. And that calculates 1 to 20. And what do you suppose these staff members do? They do everything except diagnosing, prescribing, doing surgery, and giving prognoses. Those were the 4 things we talked about that are required by law in every state, all 50 states, that veterinarians must perform. Everything else, under the proper supervision of the veterinarian, can be done by our licensed or credentialed veterinary nurse or technician. We don't do that near enough, but there are some practices now that are starting to do this. So our success formula then, I think in the future is we have to operate more as a team. We have to trust one another. We have to communicate back and forth better. We have to utilize our skills properly so that we can see the number of clients that many veterinarians are telling us that they can't see everybody. They don't have enough people and so on. Well, we do if we would change our format. Our format for practice in this country has really not changed much since the 1950s. It's still, again, as I said earlier in the presentation, that we're still having 1 veterinarian and 1 client, 1 patient in a room at a time, and we only have a little bit over 1 on average exam room per veterinarian that's on outpatient. We need to have at least 2 exam rooms if we're going to be able to make any kind of headway in being efficient. But again, our first challenge is to make sure that we're utilizing the team properly. We have to have excellent, high quality communications. We have to communicate with one another. This is a challenge to anyone who is running a practice, trying to perform proper communication not only with the client, but with our team, with our staff, so that the receptionist knows what we're doing, the technician knows, the assistant knows, the kennel staff know. We have to have excellent communications for the team to be able to be efficient. We have to have passion, and I don't think this is anything that we have to really work on at all in this profession. People are in veterinary medicine not to make money, they're in it because they love what they do and they have passion for taking care of animals and problem solving. And so we want to be passionate about what we're doing, but also we have to take care of ourselves. And we've heard a lot lately about, emotional, mental issues with too much grief in the practice when we have to euthanize or we can't treat a patient the way that we'd like to be able to do it. Uh, there have been issues with individuals just stressed out and they completely have to get out of the profession. Well, this won't happen if we're properly utilizing our support staff. And if we are relying on each other to do what we are trained to do, veterinarians doing those four things that we just mentioned, and technicians and assistants doing what they can do legally by law, under supervision by the veterinarian, our well-being will be taken care of, as well as meeting our passion in the profession. And I think it's very easy to do these things and do them right, because we're going to feel a whole lot better about ourselves and a whole lot better about our profession. So that's the information I wanted to provide to you. I may have presented more questions than I presented answers, but this is the way that I have viewed the profession today. And again, looking back over the 50 years that I've been in this profession, it's a great honor to still be in the profession. I thank my lucky stars that I'm in it. I love it. I still love it today, even after all this time. So thank you for listening, and good night, everybody.